about. Now, the difference in a child's chance of being a looked after child or on a child protection plan varies hugely according to where they live. So where I work in Coventry, there are 170 children per 10,000 who are either on a child protection plan or who are being looked after at the moment. In East Sussex it's 100, in West Sussex it's 70. So these are very big differences. If you're a kid, that's more than twice the chances of being either looked after on a child protection plan if you're in Coventry compared to West Sussex. So why does that occur, and what does that mean about how children are faring in different places? And so the central theme is, the particular thing that we've been exploring is this issue of inequality through studying inequalities in intervention rates, in the proportion of children who are subject to state interventions. So that's the first theme. And the second theme, I guess, is to focus something on the social structures that lie behind those big differences as we see it. So the relationship between the structural conditions of childhood and outcomes for children, and whether those are sufficiently taken account of in child welfare policy and practice. So I'm going to be emphasising two key points. Firstly, about factors leading to levels of demand, and that's particularly about the socio-economic circumstances of families and the ethnic mix of the population. But also looking at issues of supply, the supply of services, the provision of services, and the way in which those demand and supply services, supply issues, interact to produce a particular level of intervention. And part of this argument is that while everybody knows there's a relationship between the socio-economic status of families and their chances of being involved with child welfare system, actually the amount of detailed knowledge we have of that, of its extent and of why, remarkably poor. And that's, again, what we've been trying to fill in some of the blanks of. So just to, I don't think this is necessary in a way, but just to underline the relevance of poverty and social inequality to child welfare, there's just been this very recent report on destitution, so-called, in the UK, actually, not just in England, by the Suzanne Fitzpatrick from Scotland, published by the Joseph Rowntree Foundation. And they estimated that in 2015, in any 1 week, there were somewhere over 300,000 children in the UK who could be described as destitute in terms of this definition, which is lacking 2 or more of these essentials in the past month. So they may have been homeless, they may not have had 2 meals, as many as 2 meals a day for several days, issues of heating, of whether it's adequate clothing, of lighting, and basic toiletries like whether you have a toothbrush. So over 300,000 children in the UK were missing 2 or more of those fundamental elements in any 1 week in 2015, and 75% of those were still destitute 3 to 4 months later when they did a follow-up to the study. So that's somewhere around 200,000 children in England who were destitute for 3 or 4 months of last year. And if you think that there's 100,000 children who've been through the care system last year, maybe 60,000 children who were on a child protection plan at one time, a bit more than that who are children in need. And you think about the definition of neglect, may involve a parent or carer failing to provide adequate food, clothing and shelter for a child. And you wonder about why the focus is only on, well, I wonder about why the focus is only on parents and not on the state and the society's capacity to ensure that all children have these kind of most basic needs being met. So I hope from the, there'll be much more about this, but I'm sure you're all aware that there's very big inequalities in the proportion of children who are in touch with the welfare system in different places. But a really central question for us is essentially whether children's services make that better or worse. Do children's services just reflect social inequalities out there? Do they reproduce them? Do they reinforce them? Or do they reduce them? And I'm sure everybody in the business has good intentions. But I think we have to ask profound questions about whether those good intentions, how those good intentions work out in practice. There's going to be quite a lot of numbers in the presentation tonight, so I'm more than happy for anybody to stop me at any point if I'm saying things that don't make sense, or, well, no, I might do that anyway, but say things that you don't understand and can't follow, so please do. Let's just take for an example, this is looked after children rates in Wales and England. So if you're a child in Wales, you've got a nearly 50% higher chance of being a looked after child on the 31st of March 2015 as you had in England. That's a nearly 50% difference. These are big differences. And I tried to kind of go through the 150 local authorities in England, the 20 odd local authorities in Wales, and say, you know, Pembrokeshire is the lowest looked after children rate in Wales, Wokingham's the lowest in England, and these are the highest. And at each point, all the way through, the Welsh rates are lower. Sorry, the Welsh rates are higher. And something like 25% of all the Welsh local authorities have looked after children rates of over 100, and which is rarely the case in England. Per 100,000 children. And this is at the 31st of March. This is on a single day, not all those that have gone through the system. But, so on the face of it, there's big, straightforwardly big inequalities, but we need to try to make sure we need to understand whether we're comparing like with like. We have got essentially the same legal system, which isn't true in Scotland, and the structures are very different in Northern Ireland. We have got essentially the same kind of legal system. But if you take the deprivation scores for all the local authorities in England and in Wales, then there is no local authority in Wales that has a deprivation score as low as the bottom 25%, the most affluent 25% in England. So the Welsh, in terms of levels of deprivation, the Welsh local authorities only begin kind of a quarter of the way into the English, if I'm making sense to you. So there are many more, much more affluent local authorities in England than there are in Wales. So even at the level of, what we really need to do, I think, is to control for deprivation. We also actually need to control for the ethnic mix in the population. There are far fewer children from minority ethnic groups in Wales than there are in England. As we'll see, that affects the rates as well. And we need to double check that the data collection processes and definitions are the same. So on the face of it, we've got straightforwardly big differences. But one of the questions we're trying to find out in our big study is this all explained away by deprivation and ethnicity patterns in the population? And I can't tell you the answer to that yet, but in 6 months' time, I will be able to tell you the answer to that. You wouldn't have invited me, would you? So you might think these are very basic questions about big differences in the system. There are even bigger differences in the lack rates between England and Scotland. And one of the things that we're having to do is to try to put in some very basic baseline data so that questions about why do these things happen and what could we do about it, and is it good or bad to have higher rates or lower rates, can then begin to be answered. So, how do I define child welfare inequalities? This is the definition we're working with at the moment. So child welfare inequity occurs when children and their parents face unequal chances, experiences or outcomes of involvement with child welfare services that are systematically associated with structural social disadvantage and are unjust and avoidable. We could unpick all that if you want to, but what I want to emphasise the three key things there of chances, experiences and outcomes. So the first thing then is the chances. And what I mean by chances is who is it that receives, who is it that's subject to state children's services, such as being referred, being provided with early help, being placed on a child protection plan, being looked after, etc. And I think this is fundamentally about the social conditions or the social determinants of the conditions of family life that lead to levels of demand. The second area of inequality, or potential inequality, is in how services then respond to those children that come to their attention. Are services, service responses the same or proportionate for children of different ages, of different ethnic groups, of different social backgrounds, social classes, different gender? And thirdly, in terms of the third thing is about the outcomes of engagement with services. Do children of different identities or different backgrounds have the same or different outcomes? So those are and there has been more concern about the third one in policy terms. You know, there is quite a bit of concern about the educational outcomes and the leaving care outcomes for children. So there's a bit about that in relation to looked after children in the system at the moment. It's not talked about in terms of inequality or inequity very much, but there is a kind of a concern about closing the gap. But I don't think there is for the first two elements, nor is that kind of focus for children other than in those in the looked after system. Why does it matter? I think there are basically three arguments about why it might matter. The first is the economic argument, the costs to the state, the cost to society of the provision of services, but more importantly, I guess, of the impact on children's subsequent lives. Services, as you all know, are very expensive. Secondly, I think it's an issue of human rights. Sally Holland, the Children's Commissioner in Wales, has been writing and talking about this lately. And I think we hear quite a lot about children's rights. But the United Nations Convention on the Rights of the Child also says that state in caring for their children, as well as children having special support if they have to be cared for away from home. So we could have a big argument, big debate about the children's rights versus parents' rights, but I think there's an argument, a human rights argument. And the third one is, I think it's a social justice issue. Just as it isn't fair, a boy born in Blackpool has 8 or 9 years less of life expectancy than a boy born in Kensington and Chelsea, it's also not fair that a child born in Blackpool has an 8 times less chance of being in the care system as a child in Wokingham. So I think there's a social justice issue. Of course, I'm not saying that children never need to be looked after away from home. That's not. But if the reason for separating a child from the family is fundamentally a product of socioeconomic or other structural inequalities, then I think it is an issue of social justice. So, why is research necessary? Why don't we know about this stuff already? I think we kind of think we know. I think the sector and policymakers have kind of thought for a long time that, you know, we know there's a relationship between poverty and children being involved with the state. It's kind of assumed that we know about it, but there are actually profound gaps in knowledge. Particularly of these 4 kinds. So all the official data on children's services is about children. There is no data about the socio-economic circumstances or any of the other circumstances of parents of children who come into the system with data. And that bedevils all sorts of research in the child welfare system, where most researchers end up having to say, we know that that the families that we were researching were mostly living in poverty, but we haven't got any systematic data about it. Secondly, there's no official, i.e. no government, no state data about the incidence or prevalence of child abuse and neglect in any of the UK countries. So there are measures of children who are on child protection plans or child protection registers. There are measures of the proportion of children who are looked after. But that's not necessarily the same thing as the proportion of children who are subject to maltreatment. The NSPCC have done 2 large retrospective studies of self-report of abuse and neglect in the last 20 years, but that's really all that we have. And the definitions of an application of child abuse and have changed radically over time. So 25 years ago, of child abuse and neglect cases were attributed to sexual abuse and physical abuse. 80%, almost 80%. 2015, that was down to 16%, with neglect and emotional abuse having taken up the difference. So it's by no means clear that we're comparing like with like when we compare data over time. And so again, there's a huge gap in the system. And only recently, Andy Bilson has got some data from local authorities about what's the chances of a child being involved with the child welfare system at some point in their childhood. And he's done it, he's got data on 0 to 4, 0 to 5. But that's the first time that's been done. So we don't have data about the childhood prevalence. Before Andy had done this work, from researchers or from government. Thirdly, there's no data at a level of geography below local authorities. So all the data is reported at local authorities or above. Nothing at the level of small neighbourhoods. So we can't interrogate the data, the official data that's collected for smaller neighbourhoods, for smaller geographies. And fourthly, the data on ethnicity is extremely limited. Much of what's collected and reported to central government isn't then analysed and reported. And they use extremely general categories of ethnicity, lots of other problems with it. I actually think I almost want to stop there and say, what are we doing spending £6.5 billion in England at the present time when we don't know the most basic things about what's going on in the system? So against that background, we've been trying to, as I say, to use mainly official data to begin to just lay some baselines about what it is that's going on out there, and particularly the relationship between deprivation, ethnicity, and intervention rates. Initially in England, and now across the 4 UK countries. So all we've been doing, it's terribly simple, in these first 2 studies, is to ask local authorities, or in Northern Ireland governments, to provide us very basic data about the children who are in the system. So their age, their gender, their ethnicity, whether they're on child protection plan or register, whether they're a looked after child, and if they are, where they're placed and under what legal category they fall. Additional piece of information we've asked them to give us is a marker of the small geographical neighbourhood in which they live. Those are called lower super output areas, which is a dreadful term. LSOAs, lower super output areas, are neighbourhoods of 1,500, around 1,500 people. And the whole of the country is divided up into lower super output areas. And each of those lower super output areas has a deprivation score attached to it from something called the index of multiple deprivation, which is a multifactorial way of measuring deprivation across 7 different domains and 32 measures. So once you've got, once you know the neighbourhood that the child is from, these very small neighbourhoods, and you have a measure of the level of deprivation in that neighbourhood, then you can begin to do something which is trying to link deprivation with the children in the system. Now, we're doing that as a proxy for families' economic circumstances, because the task of gathering data about individual families' economic circumstances would simply be too large for us to do with the time, money that we've got available. It's not a very good proxy, because even in these very small neighbourhoods, some families will be better off than others. But it's the best we've got, and it's what we've done. So then we can say, for example, if these are the 10% most deprived neighbourhoods in the country, or these are the 10% most affluent, least deprived neighbourhoods in the country, what's the proportion of children on child protection plans or who looked after in each of those 10% or 20%, or whatever, however we decide to cut it up. And the third thing that we've done, which Barry referred to, is we've recently done a literature review on the relationship between poverty and child abuse and neglect. I'm not going to talk about that very much today. I mean, we can do in questions if we want to, but that's been useful to do as well. So I'm mainly going to talk in terms of findings, which I'm moving on to now, really, from the first study we did, which was in 13 local authorities in the West Midlands. And so this is places like Birmingham and Coventry and Wolverhampton, Sandwell and Dudley and Walsall, but also the surrounding counties, Warwickshire and Worcestershire, Staffordshire, Solihull, other places. So a mixture of more affluent and more deprived local authorities. And in these local authorities, there are more than 10% of all the children in England, and more than 10% of all the children who are looked after or on child protection plans in England. Although we call it a pilot study, it's actually it's a big study. It's got a lot of data about a large proportion of the children in the system. And we brought to our analysis 4 key concepts taken straight from the study of health inequalities. So the concept of social determinants, the social determinants of health, in our case, the social determinants of intervention rates. The idea that in health there's a social gradient, so it's not, if you're poor, you've got this much bad health, and if you're rich, you've only got this much. But each step up the social scale, your health is like each step. I've done it the wrong way. I mean, I'm confusing you now. But each step down, each step increase in deprivation produces greater ill health. So does that apply to the child welfare system, or is it all about poverty or not poverty? The third thing is the issue of intersectionality, the way in which different dimensions, particularly ethnicity, relate to outcomes. And fourthly, there's something called the inverse care law, which is the idea that paradoxically, more affluent communities, middle class and upper class communities, get better health services than working class communities which have greater needs. So the provision of service is inverse to the level of need. So we've taken a version of that as well. In order to make sense of all of this data, you have to begin by looking at where the children are in terms of levels of deprivation in these small neighbourhoods. Now, children are more likely to be poor than adults are. So these are quintiles. This is the most affluent 20% of neighbourhoods in the country, down to the most deprived 20% of neighbourhoods in the country. So there are more children. You'd expect, if they were equally spread, you'd expect 20% in each box, but there are more children in quintile 5, only a bit more. But in the West Midlands, there's massive child deprivation. So almost twice as many as you'd expect by chance. Almost 40% of children in the West Midlands were living in the most deprived 20% of neighbourhoods in the whole country. From 0 to 4 for young children, for the early years, the proportion is higher still. For Birmingham, almost 2/3 of all the children in Birmingham, this was in 2012, this is based on the census of 2011, almost 2/3 of all the children in Birmingham were living in the most deprived, 20% most deprived neighbourhoods in the country. It's astonishing. 50% of them were living in the most deprived 10%. It's astonishing. And if you can, I got this one here, anyway, thank you. And you compare that with Warwickshire and other of the counties in our sample, just 8% there. So these are massive differences, and unless you understand where so it kind of begins with how deprivation is spread through the child population. Okay, so remember I've got these 4 analytical concepts that we're bringing to it, and the first one is the relationship between social determinants and intervention rates. So these are our 10 deciles, from the most affluent decile to the most deprived decile in our West Midlands sample. And there's something like 11 to 12 times difference in the child's chance of being a looked after child between the most affluent, the most deprived 10% and the least deprived 10%, something like 11 or 12 times difference. No surprise there, it's just that we've never kind of put a number on that before. We've never seen the extent of the difference. And both that last slide and this one both show that there is a social gradient. It's not that it's all in the poor neighbourhoods and there's nothing at the top end. Everywhere except just this one place in both tables, both for children on child protection plans and for looked after children. Each step increase in deprivation brings an increase in intervention rates. And in this case, it's a factor of 10 between the most deprived and the least deprived neighbourhoods, slightly less than the other, but it's essentially the same thing. And there's a number of consequences, one of which is obviously that you can't just concentrate on children in the poorest neighbourhoods, because although a lot of the children in the system are in the poorest neighbourhoods, there's plenty that aren't. So you can't just do that. And it also says that there's something about inequality in the system, not just a gap between the top and the bottom. Something about inequality, I think. So the third of our key findings is bringing ethnicity into the picture. So we've got a fairly clear and not surprising, in a sense, view about deprivation, but what if you bring ethnicity into the picture? There's been a little bit of work previously done on this by Owen and Statham in 2009, is the only big study in recent years, really. And what they said was that rates for Asian children, child protection plan, children in need and looked after children rates for Asian children were uniformly lower than rates for white children. That rates for black children were much higher, significantly higher for looked after children, but lower for children on child protection plans than they were for white children. And they weren't really able to explain that. But that was what they found. And overall, we found the same picture. So the rates for Asian children are much lower than the rates for white children. The rates for black children are higher for looked after children, but lower than white children, for children on child protection plans. But really that doesn't tell the picture, because it doesn't control for deprivation, nor does it look down into the broad categories of Asian and black, or white, come to that. So again, you have to begin by looking where are the children in the population. These are using some of the smaller categories. So these are the mixed heritage children. These are Asian children from India, from Pakistan, from Bangladesh, and other backgrounds. Black African, Black Caribbean, and Black other children. And this is just where the children are in these small neighbourhoods. And you can see from here that hugely higher proportions of children from the minority ethnic groups are living in the most deprived quintile of neighbourhoods than is the case for the white children. So unless you take deprivation as well as ethnicity into account, you can't really make sense, I don't think, of the overall ethnic intervention rate, the overall intervention rates. And in the West Midlands, more than 3/4 of all black children were living in the most, more than 3/4 of all black children were living in the most deprived 20% of neighbourhoods. And am I doing that? Sorry. Thank you. And it's in the 60%, a bit more than 60% for Asian children. So that's the background.
Sorry, that blue column is really hard to...
Yes, I'm sorry. So, but this is white British children. These are the mixed heritage children, so mixed white and black Caribbean, mixed white and black African, mixed white and Asian, mixed white other. This is the Asian group, Asian with an Indian background, with a Pakistani background, with a Bangladeshi background and other backgrounds, black African, black Caribbean, and black other. Yeah? Sorry, it's difficult to see. I know it's a lot of information. But the broad points are these extraordinarily big differences in where the children are living in terms of levels of neighbourhood deprivation. So then if you kind of control for deprivation by looking just within that fifth quintile, in that most deprived 20% of neighbourhoods where the vast majority of black and Asian children were living and some white children were living, then you get a rather different perception. So for white children in quintile 5, the looked after children rate was 122 per 10,000, and it's much higher than the rate for black children. So when you control for deprivation, the thing that people have thought for a long time, black children are overrepresented in the care system, isn't true. It is true overall because so many black children are living in deprived neighbourhoods. But if you control for deprivation, there's actually more white children in the system than black children. And the proportion of Asian children in quintile 5 is 6 times less than for white children. 6 times less. And nobody's talking about this, really. No one's paying attention to this. No one's asking if this is good, bad, or otherwise. The Department for Education's research plans, published in 2014 for looked after children and children subject to abuse and neglect, has no mention of ethnicity. No mention, despite the extent of these differences. And when you drill down into these smaller categories, again, you're not going to be able to see this, I'm afraid. But the headline messages are that within the Asian group, the rates for Asian children of an Indian background, even when you control for deprivation, are much lower than those for the Pakistani and Bangladeshi groups. And within the black group, the African rates are much lower than the African Caribbean rates. So the African Caribbean rates, which are here, are higher than the white rates, after all. And they're brought down by the black African rates, so that for the black category as a whole, they're brought down by these very low black African rates. And this is, we're just, I think, is just lifting up the corner of the carpet on this stuff. I haven't got explanations for this. I don't know whether it's better, whether the children are being cared for better or less well. I don't know whether the services aren't reaching them or they're discriminating against certain groups of children. We don't know any of that. But we need to. It's just we need to. We need to know this stuff.
Oh,
Yes?
you haven't spoken about the mixed groups, and yet they're the ones who seem to continually have the highest numbers. Why?
I haven't spoken about them because one of the other problems with all this data is knowing is how reliable the data is, and we don't know really who's doing the defining of who's in what group. So many people who might be in one sense of a mixed heritage will call themselves black, or may call themselves Asian, or may call themselves white. And I think the mixed heritage category is particularly, they're all problematic actually, but I haven't talked, it's a good question, I haven't talked about it despite the high rates, because I think it's profoundly problematic, actually. Okay, how am I doing for time? Not very well. Okay, so two lots of data about the relationship of deprivation to intervention rates, which are kind of not surprising, but they show the extent of the inequities. One lot of data about ethnicity, which needs much more interrogation. And the fourth thing is our kind of equivalent of the inverse care law. And this is a bit difficult to grasp, but we'll do our best. So just read that, if you can. Can you read? Okay, so you've got, let's say you've got two local authorities. One's overall high deprivation, and one's overall low deprivation. The high deprivation authority will have more looked after children, higher rates of looked after children, higher rates of children on child protection plans than the low deprivation local authority. But if you compare equivalent neighbourhoods in those two local authorities, so if you control for deprivation in that sense, just at the neighbourhood level, if you compare equally deprived or equally affluent neighbourhoods in those two local authorities, then you find that the low deprivation local authority has much higher rates of intervention than the high deprivation local authority does. So this is why it's inverse to what you might expect. And let me give you some numbers to try to make sense of that. Okay. So what we did was to divide our local authorities into those that are in the top, i.e. the affluent third of local authorities in the country, and those that are at the bottom, the most deprived third of local authorities in the country. And this is adding together child protection plan and looked after children rates. And here for each, what this chart shows is that for each quintile by deprivation, the low deprivation local authorities have almost twice the intervention rates of the high deprivation local authorities. And that's true not just in quintile 5, but right across the board. It's almost double. Let's see where I was going to go to next. So if we just take an example of that, we looked at 2 local authorities that we've studied. One was one of those more affluent counties. One of them's a deprived inner city area, and we call them kind of county and borough. If the if at this level of small neighbourhoods, if the county had the borough's rates, instead of having 1,130 children looked after on child protection plans, they'd have only had 477. These are again very, very large differences. And there's been a paper which I only saw this morning by Rick Hood, and colleagues from Kingston, which kind of supports and goes some way to putting some explanations in this in terms of the way the system works out. And I think this reflects the fact that although the more deprived local authorities in England get more money than the less deprived local authorities, deprivation is one of the factors that's taken into account in the allocation of money. I don't think they're given enough more money. So our county had less money per head than our deprived borough. But look how many what proportion of the children in each place were living in quintile 5, where the rates are so much higher. More than half of them in the borough, but only 3%, 4% in the county. And I don't think this amount of difference is sufficient to compensate for this amount of difference. But we haven't got, it's very, difficult to get to clear the evidence about finances, but that's what we think. Okay, so to try to understand what's going on in the system, we've developed this model of what we call demand and supply, which again this article by Rick Hood uses a very similar way of thinking about it. So the intervention rates are a proportion of, if you like, in old speak, the level of need, or perhaps the level of risk, I don't know, in the population, which relates to their socio-economic circumstances and the amount of community support and that kind of factor, stuff on the left, but interacting with how the state is responding in terms of its policies and practices, where its resources are placed and so on. So in order to understand intervention rates, you have to understand the interaction of demand side factors and supply side factors in the system. We could talk some more about that. I think there's lots more we could talk about. There are these very critical questions: are higher rates or lower rates better for children? Does poverty cause child abuse and neglect? Can social workers do anything about it? I'm very happy to have discussions about all of those, but I think in order to allow time for that, I just want to finish really with talking about what I think are some of the implications of taking inequalities perspective. And I think it's not just a little bit of tinkering about the edges, but it's a fundamental rethink of the system as a whole. So I think first of all, and I think I've probably talked about this a lot already really, that we need much better data. We need to know what's actually going on in the system, who's coming into it, what's happening to them in the system, what's happening to people after they leave, and that needs to be much better reported, and that needs to be backed by much more substantial research. There hasn't been, not only is there no official data about the socio-economic circumstances of families, there hasn't been a substantial research study of that in England since Bebbington and Miles in the late 1980s. So we really don't know, either from research or from official data. So there's a big job to be done in terms of just knowing what it is that's going on, who are we dealing with, and how are we dealing with them. I think you could clearly, as you do in health and in education, have a set of policy objectives and policy measures which are about reducing inequalities rather than just focusing on identifying and dealing with risk. So you could talk about it in terms of closing the gap if you want to, or you could talk about, I mean, however you want to talk about it, you could have reducing these kinds of as a policy objective. Thirdly, I think, as I've just been saying very recently, I think we need to re-examine the formula by which finances are allocated between local authorities and probably between the UK countries as well, when we've done that data. Is deprivation, are ethnic patterns in the population and other key factors sufficiently taken into account? I'm sorry to keep going on about it, but it's an exciting paper because of the way it chimes with us. This paper in the British Journal of Social Work by Rick Cook very much reinforces that sense that local authorities that are more affluent and got more money are doing quite different things to local authorities that are working in more deprived areas and are more strapped for cash. That's basically the message. Fourthly, I think we need to the social inequalities perspective would have a big impact on the locus and focus of services. So within local authorities, how are resources allocated to services, and how does that allocation relate to neighbourhood deprivation and ethnic patterns in the population? And that clearly needs to go on in terms of practice. What is it that social workers are doing with families? Are they paying sufficient attention to families' material circumstances? I don't want this to be either about bashing local authorities or about bashing social workers. That's profoundly unhelpful. But I think it is the case that neither at a policy or management level nor in terms of frontline practice does the system support workers to address families' material needs. So I was talking in Coventry with people from the Law Centre last week, where they've embedded legal and welfare rights in the troubled families programs. And they found that for all the families that the Troubled Families Programme in Coventry are working with, every single one of them has at least one or more problems of debt, of benefits, of housing, some of them domestic violence, a range of welfare law, every single family. And what they've learned is that they have to be, as they've called it, embedded in the Troubled Families Programme, i.e. always taken, but always the legal rights worker goes with the social worker or the family worker to the first or second visit. Because if they rely on referrals from family and social workers, they don't come. They don't come because families don't know what they're entitled to. They don't come because social workers don't know what they're entitled to and miss stuff. And they don't come because, in some cases, workers are reluctant to refer. In a similar project in Ceredigion in Wales, running last year, not huge numbers of families, but they were finding that for 18 families out of the 28 where they did benefits work, they increased the average family income by £10,000 a year. £10,000 a year for those families. And in all of those families, there was the social workers recognised a reduced risk of children coming into the care system. So that could only happen social workers, social workers don't have that detail. I think the benefits is profoundly complex these days. Social workers can't necessarily do it themselves. They do. They can refer people to that can take it up. And I think the idea of embedding those services is a really important one. Inspection is another dimension of this. When Ofsted compares local authorities, what are they taking into account in terms of the population that different local authorities are serving? They have the concept of statistical neighbours. So they do try to compare like with like in terms of authorities. But I'd like to look at what criteria and what data they use to make those comparisons. And of course, I'd want them to look at how local authorities could be reducing the inequalities and the inequities in children's chances. Of course, it has implications for training. I think when there's been big political and professional arguments about the significance of poverty in social work, education and training in recent years. I have a feeling that it's a widely accepted background. It's widely accepted as a kind of background factor. It's not a background factor if you're living in poverty. It's a day-by-day, hour-by-hour factor. And somehow we need to, I would say, we need to work with that reality, not with poverty as a background factor. And finally, really, it obviously has implications for research as well as for the collection of and reporting and analysis of official data. There's a big job for us researchers to do as well. Initially, as I see it, to establish the baseline data and routine ways in which that data can be collected and replicated year on year, and a much more complicated but just as important job to understand, well, if that's the scale of the inequities, why are they occurring and what can we do about them? Thank you.
Thank you very much.
This is on, yeah. Thank you, Paul. Again, that was fascinating as usual. Quite a few questions were buzzing around in our heads, and I suppose one of them is probably is the bigger one that goes beyond the numbers, which is about whether it's a good or these inequalities, well, whether it's a good or a bad thing, whether those children who are, let's say, living, in more deprived neighbourhoods in more deprived local authorities are lucky or unlucky not to be singled out for so there's that sort of sense of the kind of the layers of interpretation that we can place on top of what are, whether the inequalities are actually in some ways good things or not. But I think the other thing that I was just wondering was about obviously your focus is very much on the kind of material deprivation, and I wondered whether you're getting any sense of the kind of there's quite a strong literature now on multiple adversities and how different adversities intersect, and whether you have any views on how you're arguing for a stronger focus, for social work to have a stronger focus on the material realities of people's lives. One of the things that we've been seeing in the Nuffield study, that Jonathan Schofield and I and others have been doing, is about the kind of intersection of multiple adversities. So poverty, unemployment, poor housing, all those sort of things come together, but with them come a whole range of other things that may either sort of lead to or come out of them. So it's really just thoughts on whether your message is really that you want the material side of things to kind of drive the picture most, because social work pays least attention to them, or whether there is a way you can suggest of trying to capture the kind of multiplicity. Is that?
Yes. Yes.
Yeah.
I mean, if you look back at Cleaver's work about what became talked about as the toxic trio, what it actually says is that poverty, as well as domestic violence and mental ill health and substance use, are the 4 key factors. But actually, even in that document, by the end, poverty has been relegated to a background feature of those elements. So, whereas I would see it as absolutely central and integrated with, poverty is a factor in mental illness, and poverty is a consequence of mental illness. It's absolutely intertwined, and so are the other things. So, yes, I've features because I think that's what's been particularly neglected. The way they're worked out absolutely is going to be through their interconnections with the, that doesn't mean that you don't tackle the poverty bit of it, I think. I mean, I think the analogy I'm trying in my head at the moment, which may not be a good one, is the seatbelts analogy. Now, if everybody wears seatbelts, then to cut down accidents, you want to do things to the roads. You want to improve the quality of driver training, people's capability to drive, under what conditions they drive, that kind of stuff. But if you don't have seatbelts, your rates of injury and death from car accidents are going to be much higher. And I think unless you have, the poverty bit is like the absence of a seatbelt. It's not a great analogy, but it's that kind of a thing. And so unless we get poverty, I'm trying to put that multiplicity of factors in a much more central way. I think the thing about is more or less better. Well, isn't it scandalous we don't know an answer to that question? No, that's the first thing to say, I think. I think the second thing to say is that it is very clear that there's a huge amount of volatility in the system. This is name dropping, I guess. I was talking to Dave Hill. And he was saying, in essence, they've reduced the number of 1,600 over a 4-year period. So a really, by a very deliberate policy of trying to prevent children coming in and trying to help encourage, trying to get people out, moving some people onto adoption, some children onto adoption, by a mixed set of approaches, they've reduced the numbers by that much. So it's not that, it's all just structural and there's nothing we can do about it. I don't believe that for a moment. The volatility in the system, the fact that numbers in rates in London have gone down when everybody else's have gone up, tells you that this, it's quite things like Essex, look at Milton Keynes' child protection plan rates when you leave this room. They're way lower than anybody else's, but you don't get lots of scandals. So the system, the volatility in the system means that we can do something about it, but if we don't have any way of measuring,
I'm stopping a minute. I've just got one response just to that point. Because the other issue about is it good or is it bad to get it, or it depends to some extent what it is. And even in your own data, you've got the distinction made in some places between CIN, CP, being a child in need, being on the protection register, and being a looked after child. And those are 3 very different kinds of service responses to what might be similar or different kinds of problems. And I wonder whether there are, the distinction between what's a good kind of response to get and what's not such a good kind of response to get may also show itself through looking at how differentially those 3 kinds of responses happen. Yeah? Enough for me.
Questions from elsewhere or reflections?
Oh, yes. That's why nobody wants to speak, isn't it, because of this. I suppose I wanted to take, excuse me, in a different direction in that I was just becoming very interested then about when you said poverty had dropped off the agenda, even of the kind of key four, so to speak, to become a toxic trio. And I was just, and I don't necessarily expect an answer to this, I'm just sort of thinking out loud. And there are some fairly obvious answers to it, but why poverty gets relegated so quickly? You know, what might be the underpinnings of this, that it's the thing that gets sidelined? And obviously there's a very clear political answer to that. But it's, I suppose I'm just coming with a psychosocial hat on, thinking, what is it that this represents for people that we can't bear thinking about? So that's in part something of an answer to the why we don't have these statistics. Yeah. And I was just remembering, and Imogen was concurring, that when we were social workers practicing way back when, there were dedicated welfare rights officers in the next office who you went to and said, and that's when the welfare system wasn't so complicated. So we have really lost a commitment to thinking about this aspect of people's lives.
Just in terms of the why, I think there's some interesting research. I think it was done by some Israelis. This is a training point about curriculum, social work curriculum, and the diminution in curricular attention to poverty, and that students, when asked, don't want to hear about poverty. They don't want to learn about it, and they don't want their placements to be focused on it. I mean, actually, quite dramatic. It wasn't about this country per se, though there may have been a paper that actually tried a comparison with this country.
Any other kind of thoughts from other tables? Get grouped by any issues that you wanted to? Yes.
Thank you. Thank you very much. My name is Cynthia. I'm a doctoral student at social work department here. I've used you very liberally. I've quoted you in almost every chapter of my thesis.
Sorry.
And one of the things I wanted to pick up on was referrals. For instance, you've got groups of, you have the children in need, you have children's looked after, child protection plan, and then you have the looked after children. But one of the issues for me when I was in practice was, I guess, the discrepancy between referrals and then children going into child protection plan or being children in need. And for me, because I'm first generation Nigerian immigrant, for me I picked up a lot of black African children being referred and not necessarily going into children in need or CPP. No, sorry, not necessarily going into children in need, but going into CPP or LAC, being removed straight away. I wanted to maybe pick up on that a little bit in your work again.
Yeah, I mean, there are two or three things I'd say. Obviously we could have asked for data about referrals and even contacts further back down the system. The reason we focused on the end of it that we did is not only because of the power of those kinds of state interventions, but also because it's clear that the further down the lower end of the system towards referrals you get, the more variation there is just in local authority practice. And I think this Hood paper that I've referred to several times does have that data from earlier on, and they describe very clearly and very well, I think, how local authorities ration their services by the way in which they move people through the system or not, and the extent. One element of that is the extent to which local authorities rely on non-state services to meet families' needs, and they were saying that in the high deprivation local authorities, where perhaps there was not enough, there wasn't so much money, then there was much more reliance on those non-state services. Whereas in the lower deprivation local authorities, many more of the children would, in a sense, proportionally be funneled through into the child protection plan type bits of the system. one of the striking facts in our service, which our research, which I drew attention to, was the very low proportion, the very low rates for Black African children compared to children with. I'm hoping that when we've done the next study, we have more data. I'd be very interested to see whether that's replicated again. And even when you have a category like Black African, well, Africa's a big. Don't need me to tell you. So Somali children and Nigerian children and Kent. Is it that in our West Midlands sample, the African children came from particular kinds of communities within Africa, and not from there's so many very, very basic questions that we need to answer, but you were kind of implying that there was something about the service response which was different for Black children than for others, and there's been some work of that kind done in the States, but it hasn't really been done here. Needs to be done. Needs to be done.
Thanks very much. Just to kind of go in a different direction, really. One way to go in my mind was the way Elaine was taking us, but that was kind of fielded. So hold that, which is the thing about parents' rights. Another way of saying that is parents' rights. What rights have parents got to state support when they're struggling with their children? And if you ask that question, a lot of the data can be reconfigured around that notion. I mean, the argument, the 48 Act, the whole basis of the welfare state was to enable poor parents to have greater rights to state support through the use of social workers and what they brought. And, we debate what that is. And social workers know what they can't bring, despite what we teach them, and that it's an impossible task often. So there is that set of issues for me. But coming from another direction is, I'm just reminded by your work, maybe surprisingly, of Robert Dingwall's notion of the rule of optimism back from his 1970s study, which seems to me to be still the best study on child protection done in this country since the last war. And in essence, he was explaining why hospitals and social workers discounted evidence of harm to children, and he developed this political argument, political explanation, which was the rule of optimism. The rule of optimism was then picked up subsequently as though it were a psychological matter, which it may or may not be, but that wasn't the point of that book. It was a political analysis of how the state operates in a liberal society, where it has to balance the rights of the family to its integrity and freedom, very good thing, and the right of the child to be protected from her parents in that family. And that work, as you know, sought to explain why there was such a low level of identification of harm and risk, and how it was explained away by cultural relativism, by recognition of poverty and that had to be taken account of, and by notions of natural love. And why would that not be happening in current thinking when it's so painful for us to be dealing with the levels of deprivation and inequality we've got now? So I'm surprised that there aren't more children identified as being at risk, actually. And I just wonder whether that kind of ethnographic way of thinking might throw a light in some way on some of the stats, and whether your research allows for any possibility of some in-depth ethnography to look at the processes of practice and to test these different hypotheses. One hypothesis that we live in a risk society and we're overdoing risk, that's the dominant ideology and has been in social work for a long time now, that we're too risk averse, it's written into everything. Or the alternative, actually, that something else is going on here. And something else is going on that opens up these ideas of rights in a non-binary way.
Yeah. Okay. I've got three things to say without being a Methodist. Andy Bilson's work on prevalence over time produces actually some very large proportions of children having been in contact with the system through their childhood. you know, in any school classroom, early years school classroom, roughly 30 kids, one of them will have been on the child protection plan. And that's without looking at the classrooms areas where the numbers have been much higher. He's saying that actually what's been thought of as a discrepancy between the kind of numbers that the NSPCC retrospective surveys come up with, proportions of people who've had maltreatment at some point in their childhood, and his prevalence figures, they're not as far apart as you might think, actually. Just a, you know, we don't know. We knew better. What else was I going to say? Ethnographic stuff. Yeah, I mean, I think there's absolutely. We're not doing it. We are doing in the Four Nations study. We are doing some on the ground case studies within individual local authorities, within a small number of local authorities, examining the details of practice and comparing, you know, the affluent local authorities and the deprived local authorities, and trying to see how, at the level of individual social workers' practice and decision making, you might get that inverse intervention relationship. So, but it's not ethnography. I wouldn't. We haven't got the time and the money to do that, but it would be good to do that. I think, and one of the reasons it'd be good to do that is that I think that the whole issue of poverty arouses very profound feelings in people, doesn't it? If you are, people who are poor don't like to talk about it, but they do talk powerfully about the shame and humiliation of the situation of being poor and being relatively powerless. And I was just thinking, as you said, maybe for some of the social workers, if they kind of know that it's unfair, the family situation in front of them is unfair, and maybe that sense of unfairness creates that kind of rule of optimism stuff that, you know, you don't want to take action because you feel sorry for people. And maybe, you know, and that's to some extent perhaps a product of an unequal society. You know, if society was a bit more equal, so odds weren't quite so stacked against people, you wouldn't feel so sorry for them, and then you could see it more clearly. But I mean, that's simplistic, but we certainly shouldn't underestimate the power of feelings in those encounters, I don't think, at all. I mean, yeah.
Yes, someone else?
Yes.
Oh, you can.
Just a couple of things. I mean, there is, Imogen, you were mentioning sort of social work education, and I think it's sort of quite long been recognised that poverty, I mean, as well as in the wider political domain, you know, we suddenly lost poverty and it became social exclusion and what have you, and I think that's really been echoed in social work education and the articulation of social work values and at every which level, that actually that adherence to a commitment to looking at material deprivation isn't anything like as prominent as it was in a different political and cultural environment. And that's not just about the kind of rampant march of neoliberalism, which of course sort of, you know, responsibilises people and takes away a focus, doesn't it, from those structural kind of inequalities. So, you know, I think it seems to have been much less embedded in social workers' psyches and mentalities anyway as a core thing to be looking out for, if you like. I mean, it's in there in the child assessment triangle and what have you, but you know what I mean. But it's also, I think you alluded to this, I think it's very hard to really to confront something, I'm sure, in social work that actually you can't do much about. And I think, you know, the more the focus comes on what you might be able to do something about, probably the less it is likely to draw practitioners into addressing with parents and families, things that they can't do anything about. Another quick observation, Paul, I'm going to be, as part of this seminar series, talking a bit about some of the findings that have come out of an Nuffield study that I've been involved in, and I won't say any more about it now except to say I've just finished trying to write, and I found it difficult, but a paper that was trying to dig beneath. We were looking not at these kind of data, but we were looking at big longitudinal, what are called cohort or panel studies in the UK, studies that follow through a representative sample of, in our case, sort of families over a period of generations, and try to understand what more about their family circumstances than Paul is saying is obviously apparent data, and look at that in relation to their receipt of or use of social work services, about which these studies ask just a little. So we're trying to fill in that bit of a sort of side of the gap. But one of the things I've been trying to do just recently, where we've still got some tremendous puzzles that come out of our quantitative analysis that are very hard to understand. And I tried this method, supported by somebody who tried using it, of actually from these enormous amounts of quantitative data to build qualitatively some individual families' histories. So taking loads and loads and loads and loads of variables about them and trying to work out what happened to them over the years. And in each of the ones I did, where there's poverty in there, sometimes as a result of, say, a long-term health problem or a disability that takes people out of work, and one parent becomes the carer for the other, and neither of them are at work, and then you see them fall into poverty. And in each case, these are the data I was analysing were actually from the 90s, because longitudinally that's where these studies were starting. Each time you could identify that at the point in the year that the social worker got involved was the year that they got welfare benefits, and their income. It was, life wasn't rosy for people afterwards, but in each case they registered that had been a benefit to them. So.